Je fais tout ça avec beaucoup de grâce. Yeah, YouTube is up and working. Excellent. Hello, I live in Houston, Texas. Angie, excellent. Very happy that you are local. We will be glad to see you. So put in your information in the bottom left of the screen there. There should be a form. Contact us or through our phone number here, 281-724-3138, 9 a.m. to 5 p.m. Houston time, of course, Monday through Friday during business hours. And we'll be happy to answer your questions and guide you through the process. So let us know what you're interested in. Ask your questions. All right. A couple things that I wanted to point out. I know we've had the questions about, the age limit. So age is not really a limiting factor. It's your overall health. We talked about BMI. My cutoff is 35. And so what does that mean? So for somebody who's 5 foot tall, 179 pounds or less will get you to a BMI of 35 or less. If you're 5'4", your max weight will be 204 pounds. If you're 5'8", your max weight will be 228 pounds. If you're 5'10", 240 pounds. So that's kind of giving you an idea of where your weight needs to be for you to be able to meet that BMI of 35 so that we can get you in and really minimize your risk of surgical wound healing problems and complications. I've operated on patients who have higher BMIs than BMI of 35, but it's very, very specific to the patient depending on where they carry that weight. But it also increases the risk of healing problems if we don't get you at a safe BMI. So let me see here. Naomi Anderson is saying she's 5 foot tall, 115 pounds. Where does that put your BMI? 5 foot tall, 115 pounds. So your BMI is 22.5. So you have a normal weight. So with that, what we would do is called a skinny BBL. So it's a combination of liposuction to sculpt you, grab some fat wherever we can, the arms, the inner thighs, the love handles, the back, the belly area, and whatever we can find, we can actually sculpt that and put in around your hip area and butt area. And the combination of the liposuction with the fat transfer gives you a very nice snatched look and hourglass look. So if that's kind of what you're looking for, of course, we're limited by the amount of fat that you have, but I think there's still stuff that can be done. So if you're interested in coming in for a consultation so we can examine you and see if we can actually improve your contours, by all means, contact us and we'll be happy to get you in. Nikki Moreno is asking, what about 5'1"? 5'1", max weight will be 185 pounds. So if you're anywhere less than that, you will meet the BMI of 35 requirements, and then you'll come in. You're very welcome, Naomi Anderson. We'll be happy to take care of you. And again, I do my best to give all of my patients the as close as possible of a realistic expectation and result that I can give based on your particular body. All right, let's see here. I think we got a couple more messages or questions. You're very welcome, Nikki Moreno. Thank you. Thank you. And like I said, put in your information in the bottom left of the screen there. We will reach out to you. Linda is my patient coordinator. She is amazing. And she will reach out to you, get a little bit more information, and guide you through the process so we can get you in person if you're in the Houston area or able to travel to Houston for an in-person consultation. Otherwise, we will start with a virtual consultation if you're out of state, out of town and can come in, or out of the country. Ronnie Reed, thank you for joining us. Ask your questions. Okay, all right, let's see here. What else do we have? I think I was talking about the BMIs. We also mentioned, I know we're getting a lot of questions also about what types of procedures we can do in the office under local anesthesia with patients awake. So there are different types. There's non-surgical and surgical procedures that we do. So we do injectables, we do lip injections with fillers, we do facial fillers as well. We do Botox and Dysport, so for wrinkles, to really help and smooth out the facial wrinkles. We also do radiofrequency treatment for skin tightening around the face. We also do Thermiva, which is a rejuvenation of the vaginal area, and also helps to treat stress urinary incontinence. So women will complain of some leaking of urine when they cough, sneeze, or exercise, and they feel embarrassed because they have to wear pads. This treatment actually really helps improve their quality of life. So that's something that we do in the office, very comfortable, no anesthesia required, no restrictions in your activity. It takes about 20 to 30 minutes in the office. We also do several surgical procedures with our patients awake. Upper eyelid surgery, I can do that very comfortably for my patients awake. We also do breast implant removal, as long as there's no rupture, because when there is rupture, it's a little bit more complicated and can be a little bit more painful. But if it's just remove the implants without any rupture, we can do that in the office. We also do scar revisions, dog ear revisions. We do ears setback. If the ears are what we call prominent, we set them back in the in the office under local anesthesia. Earlobe repairs. A lot of women will come in and they have they have some kind of trauma, or the earrings pulled through and it kind of just cut through their ear. We fix that under local anesthesia. You don't need to be asleep for that. We also do lipoma removals, which are fat collections underneath the skin that we can remove. Just balls of fat that can bother some patients. We do that under local. We also do labiaplasty under local anesthesia. So those are kind of like a good amount of local procedures that we do in the office. We are working to obtain some equipment so that we can actually start providing some liposuction, awake liposuction in the office. We're not there yet because we are still gathering the appropriate equipment. But once we do, we will definitely let you know, and we can add that to the services that we have already in place. If you want aggressive liposuction, so lipo 360, BBLs, fat transfer, things like that, I do those in the operating room. I feel like at this point it's safer, and I do all of those big cases under general anesthesia in a same-day surgical facility. So patients get to go home after the procedure. So same day, you don't have to stay overnight, and it is very, very safe for our patients. All right, let's see here. Any other questions? Share the link with your friends, please, and let them know that we are live. We're always happy to have other people come in, join us, and ask questions. We are talking about body contouring procedures. I am a board-certified plastic surgeon, and I practice in Houston, Texas. And if you've been contemplating getting a mommy makeover, a drainless tummy tuck, if you've not heard of a drainless tummy tuck, let us know. I'd be happy to describe it, the process for you. If you're interested in breast surgery, breast lift, or breast augmentation, either with implants or with fat transfer, definitely let us know. And we will be happy to take care of you. Duchesse so is asking, what's that? What is what? The drainless tummy tuck? Let me know. What did I list that you were wondering about? And I'll be happy to explain that in further detail. Drainless tummy tuck. Okay, so the drainless tummy tuck is a procedure that I do. It's my signature procedure. So the regular tummy tuck, when you get it done, you have drains. Usually you have two drains that are placed in the space where we operated. Those drains will stay in probably for about 2 to 3 weeks, depending on how much fluid is actually being produced and what is coming out. Now, my drainless technique, I actually close everything up so that you don't need drains at all. It allows you to walk upright within the first 3 days after surgery, instead of 2 to 3 weeks after surgery. And it makes your recovery a lot smoother and faster. You don't have to worry about stripping the drains coming off too soon or being pulled out too soon and developing a fluid collection known as a seroma, having it drained and things like that. So it is a much easier process of recovery. Barbara is asking, do you have to have a certain BMI? Great question. Yes, the BMI requirement is 35 or less. So, and what I was saying is, if you're, I'm gonna give you 3 examples. So if you're 5 foot tall, max weight is 179 pounds. If you're 5'4", max weight is 204 pounds. And if you're 5'8", your max weight will be 228 pounds. Question by Vicky Aisu. Where does the fluid go? Where do the fluids go with the drainage tummy tuck? So because of my technique, 1, there's much less fluid that actually is produced by your body. 2, the small amount of fluid that is left there, your body's naturally able to absorb it. So you absorb it, and then your kidneys filter it out and you urinate it out. So that's where it goes. Royal Blue. I'm interested in getting a BBL Lipo 360. Wonderful. We'll be happy to take care of you. Put in your information in the bottom left of the screen there. And my patient coordinator, Linda, will reach out to you, coordinate the consultation. If you're in the Houston area or able to travel to Houston for your in-person consultation, we will do that. If you're not able to, we will start with a virtual consultation, and all of that will be done through the patient portal, which is HIPAA compliance. So give us your information, and we'll be happy to get you in. Okay, looking forward to it. We have plenty of patient testimonials on our TikTok content. So please, if you're new to the channel, new to my Deigni Plastic Surgery TikTok channel, go ahead and just browse through all of it. I have a lot of educational videos talking about a lot of the procedures that I do. I also have some before and afters, some videos, some patient testimonials, people who have traveled from out of state, who have come to Houston to have surgery with us and have left amazing testimonials, have talked about their process, and have really enjoyed the whole process. So please go ahead and just browse through all of the content and then participate, ask questions, and I'll be happy to make videos, provide more information, and help you guys get through these, through the process. Okay, wonderful. Let's see here. Oh, another question that people will ask is medical conditions that they have. So for example, if you have high blood pressure, can you have these body contouring procedures? If you have type 2 diabetes, if you have anemia, any type of medical condition, are you able to actually move forward with surgery or not? So it all depends, but these medical conditions need to be optimized. So for example, if you're type 2 diabetic, we need to have your hemoglobin A1C 7 or less. Then we can move forward with surgery. If you have high blood pressure, we need to make sure that you're on adequate blood pressure medication to get your blood pressure controlled. We'll also get clearance either from your primary care doctor who's managing your blood pressure, your high blood pressure, or your cardiologist who's managing your high blood pressure. So if you're anemic, we need to make sure that we get your hemoglobin levels at a safe level before we move forward with surgery. So for example, if your hemoglobin is 7 or 8, that's too low. We have to bring it up. My lowest cutoff is a 10, especially for these big drainage tummy tucks, body lift procedures, hip lift, butt lift, things like that. We need to get that hemoglobin level up. Most women will have some type of anemia that is usually iron deficiency anemia. So we need to increase your intake of iron, and that will usually pump up your hemoglobin levels. So go ahead and ask your questions. Don't be shy. We're going to be wrapping up within the next probably 15 minutes here. Let me see. I've written down a couple other questions that people have asked. We talked about the virtual consultations. We talked about, people have asked, can I still have a baby after I get a tummy tuck? You can. So say, for example, you want to have a baby within the next year. I wouldn't advise that you get a tummy tuck now. I would have you wait, get your baby, finish having your baby through the pregnancy and everything, and then come in for your tummy tuck. But if you're like, I'll probably have a baby within, probably in 5 years from now, you can go ahead and get a tummy tuck now and then enjoy that time until, 5 years or whatever it is that you're ready to have a baby. You can have a baby even if you've had a tummy tuck. So that's a good question. Let's see here. Okay, people have asked about combining different types of procedures after a lot of weight loss. So we have a lot of people who are on semaglutides or GLP-1 medications, and they have successfully lost a very big amount of weight, which is fantastic. But now they're left with a lot of sagging skin, a lot of loose skin all over their body, their arms, their inner thighs. The breasts have deflated and nipples are pointing downwards. They don't like it. Their bellies are sagging, and there's like a big apron that goes over the fupa area onto their thighs. They don't like that. They're exercising. They're really trying to get into a healthy lifestyle, but all of this excess loose skin is bothering them. So they come in so we can do a full body transformation for them, but we can't do all of that surgery in one take. We have to stage those procedures. So patients will come in, and typically we'll start with the area that's bothering them the most. And most patients, it's that belt line area. So the belly area, the sagging around the hips and the love handles, and the excess tissues in the buttock area. So what I do is a body lift, also known as a lower body lift or circumferential tummy tuck and things like that. So, and I do all of this drainless so that you'll be able to have a much easier recovery. But that treats all of that skin that is bothering you in your belly area. It allows me to do a monsplasty to lift the fupa area and remove the excess tissues also in the mons pubis area. I also do the hip lift and butt lift. Gives you a very nice contour around the whole belt line. That's one procedure. And then we can stage the other procedures. Say, for example, you want to get your breasts done. So we can do a breast lift, bring the nipples, instead of having them pointing downwards, we bring them back upwards and perkier. We can either do implants or we can do some fat transfer, depending on how much fat you have available and how big you want to be. Or we can do small, nice implants that give you volume. We can also combine that with the arm lift surgery. We can do that at once. Then if you want to get your thighs done, most patients will need the thigh lift that goes from the groin all the way down to the knee. And then that's a big surgery. So that will be your third stage when you come back for that completion of your body contour. And that will be a huge transformation for your body. Laura, thank you. Dr. D is amazing. Drainless tummy tuck is the way to go. And he does an excellent job. Thank you so much. I really appreciate it. I'm glad you're doing well. So my patient, she is 3 weeks out from surgery, if I'm not mistaken. Doing very well. And she had an extended drainless tummy tuck, so the scar goes a little bit farther into the 4 weeks. That's right, 4 weeks. Usually, second appointment is around 3 weeks, but yours was 1 week delayed. But yes, 4 weeks out, so she's 1 month out, doing fantastic and very well. Very, very happy with her results, so I'm very thankful for that. And we will be posting her results when she comes in at her next appointment. Usually, I'll take the pictures around the 3-month mark. That way, it's beautiful results. The swelling's down, bruising's gone, and we can give you the nice before and afters. Claude 9. How long is an extended arm lift incision? So the extended arm lift incision, it all depends on where your excess tissues are. Most patients, it will be from the elbow into the armpit. Some patients may have a lot more tissues that actually go all the way into the forearm and to the wrist. So sometimes we can extend it all the way into the forearm. It depends, but the majority of people is elbow to armpit. That's where it usually is. And then some patients will probably go down the side, depending on whether or not they have a lot of excess skin. So it varies on the specifics of the patient. For pricing, everybody, please go ahead and put in your information in the bottom left of the screen there. We will reach out to you. My patient coordinator, Linda, will be able to give you an estimate so that you can have a budget and a price a plan or a target for your procedures. Once you get your consultation, once you go through your consultation with us, we will have a specific treatment plan for you, and then there will be a specific quote for your specific treatment, and that will be the price that you will have for your quote. Oh, so you her. I think I've had you ask questions here before. Can I be approved for the drainless tummy tuck due to no pregnancy but apron stomach from myomectomy? You would have to ask. I think you're probably going through wanting to go through insurance. I don't take insurance. All of my patients pay out of pocket. There may be some insurances that will allow you to go out of network, in which case you can come to me and then they will reimburse you, or at least reimburse a part of it. So you have to actually contact your insurance and see what your benefits are, whether they will accept out of network doctors and providers. If not, then it will be out of pocket. Oh, okay. You mean just surgery? I see. Okay, so not insurance based. So just surgery overall. Yes, you should be fine. Yeah. Anybody who has an apron, you don't have to. So that's a very good question. So the drainless tummy tuck is not just for people who have been pregnant. I can do the drainless tummy tuck in men. I can do it in women who have never been pregnant. Anybody who's had excess weight that has pushed out that skin, and now, like you said, you have an apron stomach, can qualify for a drainless tummy tuck. We're treating the excess tissues and fixing everything nicely. We call it a tummy tuck, but it's not necessarily linked to pregnancy. So absolutely, and we'll be happy to take care of you. So put in your information and come and see us. DH, why is recovery time for an arm lift to elbow? Oh, what is the recovery time? Most patients will feel like their arms are back to normal at 3 weeks. But between that time, usually you'll wean off your pain meds around 3 to 5 days. You're back to work during that same amount of time. That first week after surgery, you can take longer. Usually you'll take a week off to recover from that. And so by the second week, you're back at work, you're off your pain meds. And at week 3, most patients who've had the arm lift will tell me they feel like their arms are not heavy anymore. The arms feel normal, like they normally do feel. So that's good. So usually 2 to 3 weeks is kind of like the average recovery time for most of my patients. During that time, you'll be wearing compression sleeves and compression garments like the ACE wraps. I really like the ACE bandages because you can control the amount of tension and compression that you put on. So that's what I'll have my patients on. Contact us. You can call us 281-724-3138 or put in your information in the bottom left of the screen there. We will be happy to reach out to you and get you in for your consultation and take you, put you on the schedule for your surgery. All right. Very good questions here. You're very welcome. You're very welcome. Looking forward to taking care of you, okay? And I really appreciate everybody who is participating, following up with us, and contacting us. Meemaw, single lady 51. How much is the tummy tuck? For pricing, definitely contact us. We will be happy to give you that information. Sandy 3000. Would a BMI of 41 qualify for a full back lipo? BMI usually of 35 is what we cut off at. I've operated and done some liposuction on patients who have higher BMIs. It's on a case-by-case basis, so we have to have you come in so that we can see you and then figure out if we can move forward or not. It all depends on what you present with. So contact my office. We'll get you in for your consultation, and I'll be able to examine you and see if we can move forward with the liposuction or if we have to do other things before that. All right. Erica Gallacher is saying, please answer my question. I have not seen your question. Please go ahead and repost it. And then hopefully TikTok is not, what do you call it? TikTok sometimes removes questions. They filter these questions. So if we don't see them, it's not that we're missing them. It's just that it doesn't post on our end. So maybe try rephrasing your question, and we'll be able to hopefully see it. Again, like I said, TikTok is the one that actually filters these questions. So Looking forward to your question. Hello, Claude9. Thank you for joining us too on Instagram. Okay, remove the name from down there. So so ask your question. What are we looking for? You want some vaginal rejuvenation? There are different procedures that we can do for that. Let me know what it is that you're wanting to discuss. Thermiva, just let me know. Try to type it in. Hopefully, it'll go through, and I'll be able to answer the question for you. Vicky Aisu, do you accept installment payments before surgery date? Yes, we do. So we've had some patients that come in and they'll be able to put some installment payments. We have to make sure that all the payments are received before your surgery date. Usually two to 3 weeks before the surgery date, all the payments have to be received. Okay, so for your daughter who's 14 years old, okay, so it's really giant and sometimes it hurts her. Okay, so it depends on what she is having. For that, I would say schedule a consultation so that we can see what she has, what's going on. So like a labiaplasty is what I'm probably maybe hearing. She's got probably elongated large lips that are bothering her, that probably rub together and bother her if she's exercising, walking, doing things like that. We can do surgery for that, yes. But definitely contact us and we will be happy to see her in the office, examine her, and see what's actually really bothering her. And then we can move forward. Thank you for your question. Yeah, and that is something that we do with the patient awake. I think a 14-year-old will be old enough to be able to undergo awake procedures. Again, okay, exactly. She doesn't want to use jeans because something. Yes. Okay, because sometimes it bleeds. Actually, yeah, I understand. Yeah. Great question, Jess. How do you know if a doctor is board certified? Okay, so I'm a board certified plastic surgeon. This is public knowledge. If you're picking a surgeon, say for example in your area, and you want to know if they're a board certified plastic surgeon, it's public knowledge. Go to the website abplasticsurgery.org. Click on so when the website comes up, there's going to be an area on that homepage that says, "Is my surgeon board certified?" Click on it, put the name of the surgeon that you're interested in having surgery with. If it doesn't come back, and then submit. If it doesn't come back with the name, credentials, date of certification, they're not a board certified plastic surgeon. They may be a doctor, family medicine, OBGYN, ophthalmologist, family medicine, whatever, but they're not a plastic surgeon. They may call themselves a cosmetic surgeon, but they're not a plastic surgeon. They could also be a plastic surgeon, but they're not board certified. That website gives you the name of all board certified plastic surgeons here in the US. So that is a very, very easy thing to do. abplasticsurgery.org, the American Board of Plastic Surgery. That's who does the board certifications for plastic surgeons here in the US. And it's a rigorous process, so you definitely want to make sure that you do your due diligence, find board certified plastic surgeons. It means they've been through rigorous training. After med school, they go through residency training, minimum of 6 years. Some of us would do extra training in cosmetic surgery, aesthetic fellowship, so a full year of training where we only do aesthetic surgery, and then you sit for your boards. You do your written exams and you do your oral board exams, and the oral board exams are very, very rigorous. They test you on your practice, the cases that you present to them, and it is very, 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 very difficult. So you definitely want to make sure that whoever you're going to is a board certified plastic surgeon who specializes in body contouring procedures and does these procedures. And you can see their before and afters as well and talk to them. They should be able to explain these procedures to where it makes sense to you. All right, let's see here. Um, oh, okay, okay. You're thinking about the recovery and how to sleep with both surgeries. Yeah, so the recovery should be 1 to 2 weeks, swelling, bruising, and things like that. And definitely, there's going to be some pain medication that we give to the patient. So most patients do very well with the labiaplasty to help them. So contact us, and we will be happy to have you come in for a consultation, examine, and give a treatment plan that's based on what she's presenting with and what will give her the best results. Thank you for your question. Looking forward to helping you out, or and helping your daughter out as well. Great. Let's see. Okay, so we tick. We've talked about a lot of these things. Okay. Aha. There was one question. Do you always use mesh to um, help support the breast implant? That's a very good question. You're very welcome, Erica Gallagher. Looking forward to it. Do you always use mesh to help support the implant? I do it for all my patients who have lost a significant amount of weight, who have descent of the breast tissues. The nipples are now pointing downwards. I support that with mesh. Yes, and the one I use is Galaflex. It's a what we call a tissue scaffold. It is not permanent. It actually goes in and usually will last around 6 to 9 months, and it allows your tissues to grow into that mesh, that scaffold, and be stronger so that it can actually hold the implants and the tissues much better. Yeah. Okay. Erica Gallagher, sure. Deigni Plastic Surgery is my website. So you can go to this website and you'll see all the information on me. I'm Dr. Deigni, Deigni. Deigni is my last name. Easiest thing also to do is putting your information in the form that we have on the bottom left of the screen. And my patient coordinator, Linda, will reach out to you, or just write the phone number down, 281-724-3138, and call us during business hours, and we will be happy to discuss it and get you scheduled in for your consultation and come in and see us. Wonderful, wonderful. Looking forward to it. You're welcome. You're very welcome. Let's see here. Yes, along those lines, I guess another patient was asking about perineoplasty. Perineoplasty is, so let me give you the scenario. A woman goes and she gets pregnant. She has a baby through natural delivery. I guess a lot of women will have tears of the bottom part of the vagina and also the perineum. The perineum is the area between the vagina and the anus. That can tear, and not all OBGYNs will fix that area. So some women will come in and they have some issues with that, infections, drainage, and things like that. So those are areas also that we can fix for women if they have those problems. No amount of pelvic floor exercises will fix that. We have to do surgery to actually fix that area that was torn. So somebody asked that question today as well, called into the office. So that is something that we offer, and we're happy to take care of that as well. Okay, I think we've answered all the questions here on my list that I've written down. Do you guys have any other questions? Anybody else? Please go ahead and ask. Don't be shy. Thank you for joining us. Ask your questions. We got 2 people following us on YouTube here. Excellent. Please go ahead and write down on the chat what your questions are. We are happy to answer those and take care of you. All right, let's see here. Other people are joining in. Thank you very much. And thank you for liking the live. I appreciate it. And thank you for sharing the link with your friends as well. Let them know we do this every Tuesday and Thursday, time permitting, if I'm not operating, traveling, or otherwise, if I'm available. And we'll be happy to answer your questions and take care of you. Jackie Marie, thank you for joining us. I hope you've had a good week. Looking forward to your next visit with us and your next procedures. Hello to your husband. Stay safe. I know we've been having some pretty crazy weather these past few days in, well, east of Houston, so east of Texas. So Florida has been getting hit. I'm not sure about Louisiana, if they had any issues this time. Hopefully not. Good. Let's see here. Zainab Zaitu, thank you for joining us. I recognize these names. I appreciate you guys tuning in. Always a pleasure to see you. For those of you who are new, please go ahead and like Deigni Plastic Surgery, follow us, and we will be happy to answer your questions. Post on any videos that I have. Post a comment, ask your questions. I'll either answer directly with a text or do a video to answer, so that more patients will be able to take advantage of that. Yeah. Oh, okay, great. You're okay. Good. Erica Gallagher, you're in Baytown. You're just down the road from us. Absolutely. I'm in the River Oaks area, right by the St. Regis Hotel on San Felipe and Post Oak there. So yes, please go ahead and come in and see us. You sent the form. Excellent. We'll be happy to see you and take care of you as well. You and your daughter. Debbie, can you do lipo on the upper abdomen above the belly button? Yes, we can. Absolutely. That's definitely a procedure that can be done. So put in your information in the bottom left of the screen. There should be a form there. We will reach out to you. My patient coordinator, Linda, is amazing. She will reach out to you, gather some information, guide you through the process, answer all your questions. We'll get you in for your in-person consultation if you're in the Houston area. If you're out of state, out of country, and you want to have surgery with us, we will start with a virtual consultation. So you'll send pictures through your patient portal, and it's HIPAA compliant, safe. And then we'll be able to have a productive discussion and consultation, and then we'll get you in for your actual surgery. Most patients will usually travel and come and see us a day or two before their scheduled surgery so that I can see them in the office. So you'll see me at least 3 times before we do the surgery. I know there are some other places where you actually don't get to see the surgeon until maybe the day of surgery. I highly recommend that you get to see them before that. So for me, you'll at least see me 3 times and get to ask your questions, make sure that we answer all your questions, that you're comfortable with the process and you understand what we're going to be doing. So excellent. All right, let's see here. Princess Raju, thank you for sharing the live. I appreciate that. Thank you for liking the live as well. I can't wait to get a nice tummy tuck. Yes, Vicky Aisha will take care of you. I know you've been following us for quite some time, and you can see the results. You can see the patients. I recently posted some of my patients who were very, very kind and generous to actually sit down with me and do an interview and answer questions and also share their experience. I hope you guys have been able to watch that on TikTok and on YouTube. If you haven't been on YouTube, go ahead and subscribe to our channel. It's the same handle, Deigni Plastic Surgery, and you'll be able to see the full YouTube interview. And our patients are very generous with their sharing their experience, and definitely will be happy to have you guys come in as well. And also, once you're patients, you can share those as well. Erica Gallagher, can you talk about the prices on the live? We try not to. I think TikTok doesn't necessarily want us to do that, but we do have pricing when you call us. So definitely call us, and my patient coordinator, Linda, for BBL, she will give you estimates. She will give you some estimates. That way you'll have an idea of what the budget will be. And then when you come in for your consultation, I'll be able to examine you. No worries, not a problem. When you come in, we will be able to assess your particular anatomy, see where the fat is, what areas we need to do liposuction on. Some patients may need more areas than others. So that will affect your specific pricing for the BBL, and it will give you need everything. No problem. We'll go through all of it and explain everything. And that will pretty much we will give you a quote after that consultation, because now it's specific to you, because I know I have a good estimate of how long the surgery is going to be. Facility and anesthesia times, they bill based on the minute. So how long do I estimate this particular surgery is going to be for you? Tropical exotic treats, thank you for joining us. And so definitely we'll be happy to give you that quote, and that will be your pricing for your specific treatment plan. Okay, let me go ahead and let TikTok know that we are still here. We've hit the 1 hour mark. Very happy. Okay, good, excellent. Tina, I'm so happy. I'm glad that your husband is also watching and listening in. If you have any questions, you can always ask them on the live. If you don't feel comfortable asking them on the live, by all means, call us and we will answer those questions as well, okay? And when we do the virtual consultation, he can be present as well, okay? So he can ask all the questions. Thank you. That's a very good point. Erica Gallagher is saying, don't talk about plastic surgery for a woman. We always want more and need everything. I'm happy to take care of that for you as well. But this is a very good point. Talking about husbands, significant others, who are actually participating and supportive in this process, it's very important that they also are informed so that they can participate even more during the recovery process and the whole transformation, I guess, for the patient. Most patients will be women. We do get men here and there that have surgery. We've got a couple who have been following us and are interested in coming in for their surgeries. So we're always grateful and happy to take care of them. All of these procedures, the techniques, definitely are applicable to men as well. So the liposuction technique, the fat transfer, the tummy tuck, all of those techniques, I transfer them to men as well. It's not gender specific. Of course, you do aesthetic-wise, that's the art of aesthetic surgery and plastic surgery. You contour things based on what the specific patient wants. So I wouldn't contour a man the same way that I would a woman, of course. All right. I have a really good solution for hubs that don't want to pay. Don't pay, don't touch after. I will let you handle that. That's very funny. Yes. I just had that conversation with my patient coordinator Linda today, how when I see the husbands coming in with their wives, a great deal of them are very like this. And I'm like, you gotta loosen up. Your wife is going to have the surgery. Please support her and be happy. There's a big difference, I guess, between men and women it's just culturally and just everything. But we're not going to get into that tonight. We're wrapping up on this Q&A session here. But after, have a giant smile. Yes, exactly. So very good, very funny. I definitely understand totally what you're saying. And please, always nice to have the husbands coming in for the consultation, coming in for the pre-op visits, and also coming in for the recovery follow-up visits as well. That really shows that they're definitely invested, committed, and are very supportive of their wife, significant other, girlfriend, fiance, friend, whatnot, whoever it is. Yeah. So thank you very much. I'm glad that you've been able to participate and enjoy the live. Looking forward to it, and I'll take excellent care of you. All right, I think we're going to be wrapping it up tonight. I really appreciate it. Erica Gallagher, thank you for putting that huge smile on our faces and making us laugh, a good laugh and genuine laugh. I think all the women on the live definitely appreciated that and definitely know exactly what you're talking about. We look forward to taking care of all of you. And until next time, again, so this time will be Tuesday. Yes, you'll see us in person. I enjoy laughing too, and I love making people laugh too. So I look forward to our in-person consultation, and I look forward to taking care of you and your daughter as well. Until next time, Tuesday. For those of you who are going to be on the live, for those of you who are coming to see me on Monday, I see patients on Mondays and Thursdays. Looking forward to you on Monday, seeing you on Monday. Otherwise, I'll catch you on Tuesday on the live Q&A. Have a good night. God bless you, and stay safe. Have a great weekend, okay? Bye-bye. Thank you very much, everybody. Have a wonderful night. Bye-bye. Okay, my YouTube family, thank you for participating and listening. Have a good night, Tasha Curtis. I appreciate it. And hopefully we will see you next time. You too. There you go. All right. Take care.